Your doctor has given you a list of orders. You need to walk, you need to eat better, you need to quit smoking, you need to take your medications. But oh my God, where do you begin? That's what we're talking about on this week's Ask NP Deidre. Welcome, everyone. Really appreciate you joining us. I'm Kim McNicholas, and with me is NP Deidre. Make sure you follow her, subscribe to her channel at youtube.com/. The @ sign NP Deidre, nurse practitioner Deidre. We have a special guest today. Tell me why we've brought in Coach Beckie.
So Becky is a holistic health practitioner, and her coaching style is pretty amazing with the transformation that we see in patients who walk this journey with her. And so I just wanted to have her on here because sometimes patients get stuck. They don't have the means to have support at home on all these changes that their physician or provider has asked them to do. So I think adding in a support person in your corner is really helpful. So I wanted to introduce Beckie Farrant. She works with a lot of our patients, and we just have such a great success rate when we complement everything we're doing, because none of us can be the one and only thing our patient needs, right? So.
Yeah, absolutely. I think, obviously I'm working with different providers and physicians that are, giving these directives to their clients. And oftentimes they don't have the support at home. Oftentimes they have lived a life that obviously has gotten them to maybe this disease or diagnosis. And so to have to turn everything around oftentimes feels very overwhelming. And so a lot of the patients I work with are just, people who feel like they just need like extra support and handheld. And maybe it's just like in the very beginning, that first month when they're having to make some transitions in their diet or something like that. And because I have a background in holistic health, I also am able to, like, if they're having any symptoms or things like that, I'm able to communicate with some of with the practitioners of, rather than them getting bombarded in the portal of all of these messages from the one client. I kind of stand in between, and a lot of times they just need to know that they're doing it right. There's some people that just need that every I dotted, every T crossed, and they want to know that they're doing it right. And they also just need encouragement, because oftentimes when you're on a health journey, you don't see where you started and where you are now. And, someone who can kind of step back and look at things, I could be like, oh my gosh, look at the life changes. Look at, you're no longer feeling this way. You don't have this symptom anymore. Because often when you're in the middle of it, it just feels so overwhelming that you forget to like congratulate yourself and celebrate your wins. So I think a lot of it is just checking in with my clients each week of how things are going. And I have a specific system that I use that we can talk about. But I've really noticed that, the success rate of clients that use coaching versus not is astronomically different. So I highly recommend having, coaches in your practice that you can refer clients to, and also, for patients to just take advantage of the extra support that they might be able to provide.
Exactly, because sometimes, especially when we're looking at our patients who are in this peripheral arterial and cardiovascular world, their visits with their practitioner is about 15-20 minutes. And then they're left
Maybe.
with,
If
yeah,
that.
yeah, they're left with a laundry list of very new things that they need to change. And Becky has like this great technique in how to help patients understand their why and their transformation. But I love when she sends me something and is like, this is my plan for the patient. And I mean, it is just so detailed, and I love every aspect. And I know that she's going to be implementing that with people. And I'm like, you just know that is what people need, is that extra support to really optimize their health. So.
Yeah, and when I'm working, obviously I'm taking whatever the practitioner says, like I'm not making up my own stuff, but a lot of it really just depends on where the client wants to go. There are some people that literally just are like, hold my hand, hold me accountable. And so, like, I'll tell you, one of the craziest things that I found working with patients is the water intake. I should say the lack of water intake. Simple as like, me sending, text to them like every other day of like, hey, what's your water intake today? And then just celebrating a small win. Like, I got 120 ounces of water in my body today. It's just like, oh my gosh, like you went from 30 to 120. Like, let's keep that over and let's just watch to see the changes that are happening in your body. Most of the clients that I'm working with seem to be, severely dehydrated. And so, just, I know that sounds silly, but like nobody nobody in their life oftentimes is like championing them, or like, I mean, we get a trophy for everything when we're a little kid, but when we're adults, it's like we don't celebrate those small wins. And so, for me to just say you're doing a really good job, like you are putting it in the work, I'm really proud of you. Like, it's amazing what it can do in the journey of somebody who's struggling with their health.
And it can also, I mean, it's amazing what it can do when they don't give the little attaboy, attagirl. And it's not that these patients necessarily need someone to gush over them or need a lot of time with them. They just need that moment of acknowledgement. And we have a member of our network who literally a year ago could barely even make it out of the house. He was frozen in fear because he thought being diagnosed with PAD, he would end up the same as his mom with an amputation. So why bother? It's debilitating pain. And you know what? Even if I did walk, I go outside my house, I go down the block. I probably won't be able to get back up the hill to my house. And so he just sat there, went on the internet, ended up finding us, and through our community support network and weekly seminars and such, he got the motivation. He started walking, pushing through those leg cramps. And 6 months later, he walked a 13K. His ABI results improved, right? The
Yeah.
snaps. I love that. Elle Woods. Um, and he went to the UK just recently, now a year after diagnosis, excited that he has seen a regular vascular surgeon for the first time. Takes a year to get an appointment sometimes there. And the doctor, he was so excited to share with him everything he'd done. And the doctor looks at him and he's like, okay, well, then I'm discharging you. Just keep doing what you're doing, and walked out.
Yeah.
And he literally immediately was demotivated, went home, went down a rabbit hole, completely depressed. Why bother? And a doctor might say, that person's emotionally disturbed. Like, I can't even be bothered with it. But you know what? I would say 99% of patients just need that little attaboy, attagirl, the acknowledgement to say, wow, you're the poster child. Great job. Keep doing what you're doing. I want to see you back here in a year, or I don't want to see you ever again. And if you keep doing that, man, your blessing is you'll never see me again.
Yeah. Yeah, I had a patient this week, last week, I mean, like had sent the practitioner portal message after portal message, and so they hooked him up with me. And in 1 week, like I had met with him again this week, and it was like night and day difference. Like he was ready to go to a GI doctor and a psychiatrist. Like he was so desperate, like because he was having some symptoms that were just so overwhelming to him. And so just him being able to check in with me, like he even said, like just knowing that there was somebody there that I could reach out to that understood, he said made all the difference. It was like I was talking to a different person this week, and it was literally only 7 days ago, but just having my support for a week, like, and he was doing all the things right. Like he was, he was putting in the work. I can't put in the work for him, but I can certainly cheer him on and be like, you're doing great. Like, oh my gosh, that's amazing. Like, again, like he doesn't need like necessarily a cheerleader. He just needs to be affirmed that, hey, all the small changes that you're making, they're going to add up. I promise you, we're going to get to a different place. And oftentimes when people are in, just chronic pain or just hear a diagnosis, it's so overwhelming to live with that burden. And just knowing there's somebody else, it's almost like they feel like they give half the burden to you, even though you don't, because you don't feel that as a coach. I don't feel that. I'm just able to support along the way. It really does make a huge difference.
And what are some of the things, Beckie, if you can share, that you address with patients that you work with? Like what are some of the things that you work through with them, just to give an idea? I know we've talked a lot about water content and just that cheerleading, but like in their daily lives, what are some things that you can talk to them about?
I call it the DRESS protocol. So I go through diet, rest, exercise, stress, and supplementation. Oftentimes you find they're just not taking their supplements, or there's something bothered them, so they thought it was this supplement, they just like removed it without ever like having a conversation with a practitioner. But I'm just, so I go through each of those. Okay, every time we talk, these are the things that we're going to focus on. So with diet, I talk about their diet, but also their water consumption. Okay, so what does it really look like? Are they getting enough nutrients? Are they getting enough protein? Are they getting enough fiber? Whatever diet that was set for them, we kind of go over, the wins, where they need help. A lot of times they need ideas, like, I don't know what else to eat. When they get like, they feel like they can eat 3 things. And then I'm like, great, I'll send over 5 recipes that, you can eat. So then they're like, get so excited to try something new or to have a plan that's specific for them. And then with rest, okay, like, are we maximizing your sleep? Because we know that you're going to heal best in a rested state. So, okay, so what are some things that we can do? And so oftentimes that will lead into stress support. Like, I might do with the stress support, like some vagus nerve exercises. We might talk about box breathing, obviously like prayer meditation. I might send them, a few YouTube videos to help, like, relax them, things like that. So I have like an arsenal of little things in each category. They're exercise. Sometimes, they're not supposed to exercise. Sometimes they're supposed to at least walk. Sometimes we're supposed to be lifting weights. It really just depends on where each patient is at. It's just like, okay, even if they say, oh, I didn't exercise at all this week. And then I would say, okay, what was more important to you? Or what got in the way? Or what's holding you back? So I'll ask like deeper questions, and people want to stay surfacey and just say, oh, I couldn't find time. Okay, so tell me what was more important than that. And so then they're, I just keep asking the question until they get down to the fact of like, okay, it's never about time. It's usually about how much they value themselves. And so there are a few patients that will allow me to go really deep with them. It's just like, okay, you don't feel like you're making a difference. Okay, so tell me more about that. When did you first feel that in your life? And so I will go deep with my patients if they'll allow me to. And that's like my favorite. And it's not like, I don't use techniques that are like like more of a counselor, but I more of just the transformation of just like, you got to understand like where some of these mindsets came from. And a lot of times when you have like a diagnosis, like they didn't just have this because they had a health crisis. There's emotions behind it. We know that the body keeps a score for emotions too. So a lot of times I'll go, in that regard too. And then, I talked a little bit about stress support, and then their supplementation or whatever they're supposed to be doing. Like, are you following that? Where can we make tweaks? And then if I need to talk to the practitioner afterwards about, hey, they're having these symptoms or whatever, then they can either follow up with them or send them a portal message or whatever. But I kind of serve as just a liaison sometimes between the practitioner and the patient, as far as like being able to talk and break down what's going on with the patient if they need more support or a different medication or a different supplement or things like that.
This is amazing because I feel like we're taking a page out of the playbook of motivational interviewing with Miller and Rolnick, which it's incredible. It really works. What do you find in terms of motivational interviewing, the techniques that really work? When people ask me, for example, I'm an Emmy award-winning interviewer for broadcasting, and one of my favorite motivational cues is really, huh, really? You don't? Wow. And then they get really excited and get more and more. So that was like out of my playbook. Give us some tricks out of your playbook for working with people who want to improve their health.
I use a lot of like, tell me more about that, and so that usually, like, if they'll say something like, yeah, I committed to exercising this week and I, just got busy. I'm like, okay, tell me more about that. And so then they'll say, well, that I had this work project, da, 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 da. And I'll say, okay, tell me more. How much more time did that take? And I just keep asking to tell me more until they get to the place of where it just gets deep enough that they realize it had nothing to do with time. And it had a lot of times to do with, we talk about psychological assessment and committed action. And so oftentimes when they come up with an excuse or something like that, it's just because they got in their head. So my goal is to get them out of their head into committed action. Okay, it's fine. We blew the week. It happens. Like, we all mess up. Whatever. It's not, I'm not here to judge you, but what committed action are you committed to? So it's just kind of a reset for them. And so I talk about psychological assessment versus committed action. The opposite of psychological assessment is committed action. And so if you are in a place of either making excuses, this isn't going to work, it's going to take too long or whatever, it's like, okay, I see that you're in your head right now and I can feel that. Okay, let's talk about how to get out of your head and how to get back into your body and what's your committed action for this week. in order to move forward. So those are two things that I find that usually will switch people pretty quickly, and they're like,
Yeah.
"You're right," and I don't come in with judgment. Like, I'm okay. So you didn't, eat all the servings of vegetables you were supposed to this week. Like, okay, like I'm not there to judge them. I'm there to support them and just give them tools to be able to move forward.
Can you, this is a really important point that you're making, because a big demotivator is just getting in your head and kicking yourself for not meeting a particular goal. For example, with folks in our smoking cessation group, if they end up, they've gone 2 days without smoking and suddenly they ended up having one, they're kicking themselves for that. And I always tell them, well, the stress of kicking yourself for that is going to cause you to never quit, because then you're going to have another craving, another craving, another craving. And soon you're back to where you started. How do you get them out of that vicious cycle to actually accept the fact that, you know what, it's okay that you slipped, you fell off the wagon once?
Yeah, I think with a like your particular example, I want to know what was the circumstances surrounding that. Like, okay, so you slipped up. Tell me what happened. Like, tell me. It's not just like you literally fell over and into a cigarette. Like, what happened? Were you stressed that day? Like, what are some things? Like, what were you thinking before you grabbed it? Like, so I try and get to the why of what happened, before I'm just like, okay, let's set a new goal. Like, like now we're going to try 3 days without smoking. Like, is trying to understand there's always a reason why they gravitate towards an unhealthy pattern. And so if you're able to get them to see, oh my gosh, like I didn't even realize it, but I snapped at my daughter and I felt guilty. So I grabbed a cigarette. It's like, oh, okay, interesting. So one of the things that we can see a pattern is that when you feel like you've blown it or you've hurt a relationship, your first instinct is to go smoke. Yeah, you're right. Oh my gosh, I didn't even think about that. But yes, I do that all the time. Okay, tell me again, tell me more. Tell me another time that may have happened. And they'll think about it, or maybe the first time you smoked. What was around that? Like, so I try and get to the like why did they get there? I don't take anything at face value. Nothing is ever just I picked up a cigarette. There's always a reason behind that. It's never busyness, it's never, stress. There's something that, caused them to do that. And so if I can get them to realize the behavior, then they're more likely to make a different choice next time. And so I'll even say, hey, next time that something like that happens, how about you reach out to me? And we just have a quick, texting, message about it or whatever. So we can kind of walk through it and we can just say, okay, like, how can we go repair that relationship? Or, what can we do with my daughter rather than go and, to the cigarette? And because then you would have the cigarette smoking, which isn't healthy for you, and you made a commitment that you didn't fulfill, and you still have to make it right with your daughter. So can we cut that out and go back to like, okay, how do we repair this relationship? So a lot of that stuff is just we just have become so used to being on autopilot that we just don't see some of the things that other people can see from the outside. So I don't know. Does that answer your question? Is that helpful?
Oh, definitely. And then what's it like between, you and the practitioner in terms of how you share the information and their feedback to you on how their patient's doing? Can you share a success story between you and Deidre?
All right, Deidre, which one you pick?
Oh, we'll
So
take them all. Sounds like
yeah,
there's quite a few.
there are quite a few. And actually, this was just a really cute one that I was working with a patient and, a lot of female patients for me in that menopausal age range and everything. And I can sit in a room and know when somebody needs that extra support. And I'm like, I have the perfect person for you. And especially if I can tell they're hiding their why, because the first time I meet somebody, I might not get to their why. I'm spending an hour with them and, they're wanting to know all the health things and this elaborate spread of labs that we do and everything. And so it takes up a lot of time. And I sent a woman to Beckie, and I actually know when you talked about the water, it was probably her, because when I seen her, she goes, you have no idea that I was only drinking like very little water and how much better I feel just that she told me to drink water. And I was like, it's so awesome because it's just those little changes. And then we've even had like a patient who the first time she met Beckie, like really disclosed something that was such a trauma as a child that really set her on this trajectory of just a really bad health diagnosis. And I'm not going to put it out there, but like had never spoken that to anyone, and she was able to like work through that with Beckie, and then we're working through things, and she's doing things that she had never done in her health before, like eating the right way. And so just that person to help pull that out, just where it's a safe space. That's what we do at Aspire, is we offer a safe space. And Beckie's doing that too, and she's able to help with this transformational coaching, and it truly is transformational.
Yeah, and I think giving credit where credit is due, Deidre is an empath, and so she is able to intuit when it would work well for me to work with a client. So it's been a cool pairing, like for her to just be able to say, "Hey, this client could really benefit from working with you or whatever." So there's one specific one that she's talking about, as far as that is one of the patients that did allow me to kind of go a little bit deeper into childhood and stuff. And so she had this belief that I'm not enough. Well, if you're not enough, you're not going to be taking care of yourself either, because if you have that belief, like you're not going to be eating right, you're not. And so she got into a place with a diagnosis that was pretty severe. And so we were able to really figure out when she first felt that way, and we were able to kind of combat that lie. And we actually did like a whole meditation thing with her, and she went back to her like previous self. I mean, it got pretty deep, because that is the deeper transformational coaching that sometimes clients will allow me to do. But like she said, with the people with just the drinking thing, is just like, because I'm not looking they're already working with a practitioner, so I don't have to go through all the detailed health history. I could read Deidre's notes, and then I could be able to fine tune some little things. And when I work through that dress thing, it's pretty obvious why they might be feeling the way they feel, and so we're able to make little tweaks. And oftentimes, if they're having symptoms or whatever, I'll reach out to Deidre, and then she'll say, "Hey, why don't we just tell them to go ahead and back off this, do a half a dose of this." And that's all they needed. And so they don't constantly have to be talking to Deidre. I'm able to like also communicate some of those things as well. So it's just been really effective working, together, as far as, with her patients, and working together. And then of course I'm writing notes back and forth so that Deidre will be able to see next time she goes out what we worked through as well, so that she can bring that up, and we can kind of holistically work together with that patient.
And many patients will start with Beckie and do things, and like, because she also can dive deep into some of these functional medicine labs, especially gut health. Had to put that in there, Kim.
We haven't gone one show where we don't talk about gut health.
Never will.
Nope.
But she's started with patients, and then when she gets to a place like where she needs one of us, and she'll say, "Deidre, I think this needs to happen," or would you consider ordering these labs and stuff, other things. And so we truly work as a team, connected. Like she had a pediatric patient that she'd been working with, and they needed prescription, for iron and things like that. And like, as a team, we have really helped this person get to more optimized health. And that's what it's about. That's what practitioners, like, we sign up for helping people. But the medical model really prevents that in many cases. So
yeah, and it's just knowing too that, I mean, Deidre's inbox is already so full, and there's so many other things that she's looking through labs, and she's having to respond to portal messages and all that kind of stuff. So if I'm able to take a load off of her, because there's so many questions that come to her that I can answer. And I'm less expensive than a practitioner, I'll be honest there. And so, they can come through me, and I can be able to tweak some things as well, because I do have, the ability to work on, work with supplements and stuff. If it's obviously a prescription or anything like that, Deidre will handle that. But also it's lightening the load of a practitioner as well, because they're not having to answer the 7,000 questions that, at the basic minuscule. I mean, when Deidre's talking to a client and she's either giving a diagnosis or giving a protocol, they're down to, how many grams of fiber, how many drops of water should I have? Like, Deidre doesn't have the space to do that. And, as I go through the dress protocol with them, at the end, I also send, okay, this is what your committed action was this week. And usually it's just a few things. It's like, okay, my goal is, I went from 12 ounces of water. My goal is 52 ounces of water. It's like, okay, great. And then we might work through, okay, my exercise routine. My goal is to get 10,000 steps 3 times a week, or what, usually I have them set 1 to 3 goals, depending on how I read the client. Sometimes you're like, get in the water and it's going to be enough for that person. And then some people are really, as I work with them, okay, give me more, Beckie, give me more. I'm really ready to take it. But oftentimes it starts with a small baby step a week. And then the next week we kind of add and layer things in.
And we know in a traditional model, Kim, that you might just get a handout from your practitioner. This is what you're to do. And then you go home with this handout that's really beautifully made, but you don't have that connection. And really, it really boils down to human connection. If we're wanting to actually heal our patients, there needs to be that human connection piece.
And I'm wondering, a lot of people are betting on the AI human in a sense, where it's a replica, replica of you, where it looks like you. They're using AI as people are engaging with it right now and writing. Well, instead, AI will be processing it and have a human-like structure, right? It's just going to be a duplicate of you. Do you think that is going to um replace regular coaches? And I'm not saying this to be rude, because actually I really don't think that there's ever going to be a time. I think that there might be a time where they start to go that way, but I think that we are human and we're going to go back to the human connection, because there are already automatic, systems. There are apps upon apps upon apps that will send you reminders to drink water and to exercise. And there is a certain subset of patients but it's a small subset of patients. It's certainly not the majority that literally can manage with that for a long period of time. It might be fun at first. It might be a novelty. You get the water bottle that tells you that you drink, to this line before 2 o'clock, this line before 3 o'clock, this one, whatever. But for the most part, most people are going to be like, well, oops, now, 3 weeks in, wow, I haven't even drank this far and it's already almost the end of the day. You need that human connection because we are human. I could be completely wrong. You can poke holes in my theory, but I think there's always going to need that human touch for long-term accountability.
Yeah, I agree with that. And one of the things, there's these labs out here that people can go and purchase, right? And then they get this whole printout of what they should do. And I will tell you, without interpretation and without that human connection, all that I'm seeing that it's doing is causing anxiety with my patients. Because the minute they see something that's abnormal, or they know something's not right, or they're having trouble with a supplement or anything, when something is not right, which AI is not driven to do that, there's no human connection, then it just causes more anxiety amongst patients. And so I think there's always going to be a need for human connection when it comes to healing.
Always those outliers that will be good enough. There are those people that can just AI a diet and be okay with it. But like I learned about myself, like I will never exercise in my basement by myself. I thought I could do it, and if I just had a little bit more discipline, and then I just realized actually I'm motivated by people, and I will go to a gym and just to be with the community and move my body. And so, like you said, I think that human connection is always going to be king for a lot of people. Not for everyone. I think there are some people that, outliers that can, chat GBT up a diet regimen and be strict like that. But for the majority of people, I think that human connection, and you use the word accountability, because knowing people have to report their water goal to me every day or every other day or whatever, like it's amazing how, they're like, oh my gosh, Beckie's going to ask me. And so they're sitting there at 10 o'clock at night sipping water so they can hit their goal. Like there's been people that are like, literally will tell me, oh my gosh, I'm walking around my nightgown trying to hit my step goal because I knew you'd ask me. Like, it's just that piece where it's like, also they don't want to disappoint because they don't want that relationship is important to them. And so I become like important to them, where they want to make sure, that they're doing what they say they're going to do, because, I hold my clients accountable. Like, I'm like, okay, you are committed. You're okay. Your butt is on the line for these 3 things. Are you okay with that? Do you want to back off? Is there any goals you want to change? Like, I don't drive the goals. They do. And so, I think, that accountability piece, having to check in with me has been a big win for people.
Yeah, I agree. I think that that is so important. And I just can't imagine that a duplicate of you in AI. I've used ChatGPT a whole bunch on a lot of different things, asking them about this, that, or the other thing. And boy, NP Deidre knows I've done that with my test results when I couldn't get into my GP. And I'm like, Deidre, I'm gonna die.
Yeah,
And she's
it's
like,
like information without interpretation and human connection causes that our mind to get stuck in that anxiety state for sure.
and I think there's so much liability because, with an AI, because what if, nurse practitioner Deidre, and I imagine Becky, you must be the same, because you work with her. I mean, she's constantly reading, she's up on everything new and next and whatever. And no AI, generated anything can literally get the up to the minute of what's going on, right? In terms of, I mean, you have to tap into every single resource. You could argue maybe it can, I don't know. But I think that in order for them to be able to do what they're going to do in a coaching situation, be HIPAA compliant, meet some sort of evidence-based, protocol, they won't be able to incorporate that real-time data. Am I correct? Because it all has to
Yeah.
go through some sort of process versus you can process it, make sure it's aligned with protocols and be able to express it right away.
Right. And when you're talking to a patient, one reason I love to do in-person appointments for a lot of people is you can read the person's body language. And you can know when they're uncomfortable with something or when they're not present in the room with you. And you can do that virtually as well, but you can't do that with AI. They cannot read you. They cannot read like your energy and what
Yeah.
is making you bite your lip or shift positions or like look away from the screen. Like AI can't read that. They don't know when you've hit a spot where you could go deeper, where you could pull, like get into something transformational for this person. They could give you data. Yeah, it can give you data, but it can't read you as a human.
No, I think that we're securing your future, Becky. We like you.
Yeah, I get a lot of joy out of it. I mean, I think I'm a natural empowerer. I'm a natural like encourager, and so I think it comes naturally to me to I want to bring the best out of you. And it's like every client I see, like I see them in their greatest version of themselves. Like I see them healed before they're healed. I see them like 6 months down the road. Like I don't know why, I just have this vision for them. Like it's really easy for me to speak to that person rather than hold them small in the spot that they're in right now. And so I think, when they're in that spot and they're feeling so small or feeling so overwhelmed, to remind them of like their greatness and what I see in them, like you're going to get there. Like I see this like tenacity in you. You want to do it right. Like you're showing up every week, like you're going to get there. And just holding them to that version rather than holding them small. And I think the world is really good at holding us small. And you need somebody who sees something greater in you or sees the journey ahead of you and knows that you can do it.
Right. You're always going to hold on to that light for them, right? You'll meet them where they are, but you're going to guide them where you want them to be. And it's interesting that you say that you see people in their wellness. That is the number one thing I hear from every single advanced skilled limb salvage specialist when they go in. And I always ask them, how in the world do you think you're going to get through these complex lesions? Like, how do you get through the blockages in the arteries that no one else can? And they say, because I see it. I see them in their wellness. I already see before going in that their blood flow is restored. And so that's incredible. I see this common thread, and I see it even NP Deidre, you too. You see people in their wellness. Sometimes I feel like, you tell me like, sometimes I feel like I want it more than they do. But hopefully I can get them there because hopefully they'll see in themselves what I see in them, right?
Yeah. And a common thing that I often ask people is like, what does the well version of you look like? Because if they don't see it, then we know we're working on mindset. Like you have to see yourself well. And I know this from my own journey, like open heart surgery. I couldn't even walk to the end of my driveway, devastated about that. And literally every day I thought of myself climbing a mountain until I could do it at 8 months. I was on top of Mount LeConte, highest mountain in Tennessee. It's mindset is everything when it comes to that, and just visualizing yourself in a well position.
Yeah.
I'll often say, if you could wave a magic wand, what would your life look like? And that can kind of guide them a little bit more in their why of why this journey, this health, this wellness journey is so important. And so, and most of the time, if you can get people to your why, I mean, I say, I'm not your why until you cry. And so when you start getting emotional, I'm like, okay, we hit it. Like that's where we get to go. And so oftentimes, I'll make sure I write that down. So I'm constantly bringing up that version of them that they, with their magic wand, they got to create, to hold them to that on days that are tough, because let's be honest, there are lots of days that are tough on a wellness journey.
Yeah.
So you talk about the why. So it's really that purpose driven approach that you're talking about. Um, what about those people that live alone? They're retired. Their family may live far away. What does finding that why look like for them? Do you find it's a little bit more difficult than with those who are surrounded by family and friends? We have a lot of patients that live out in the middle of nowhere that live alone.
Yeah, I mean, I have experience with a few of those type of clients. I haven't worked a ton, but generally, I can get them to dream somehow. It's like, okay, I might have to go to an earlier version of themselves if they've gotten very settled in their life. Okay, well, what about when you were in your 30s? Like, what did you want to create? Generally, I can give them a vision. It might not be a clear why, but it might be one step that they can like kind of hold on to, of like, it might be like, Deidre had said, like, man, I just want to be able to walk a mile, so it might not be their deep why of like, oh, I'm doing this for my grandkids, or I'm doing this for my, I want to live with my husband forever. Like, it's not, I might not be able to get there, but they can at least come up with a why goal, that's something that they can connect with.
Yeah, and I think sometimes the more ill a patient is, they can get into their head of the things that they can't do. And so just recognizing the steps that they can and what brings them joy, because ultimately that's what we need to be thinking about, is what brings them joy.
Yeah.
That is actually a really good way. Can we explore that a little bit more? Because I think sometimes for people, the why and the purpose in general, like those are pretty deep concepts. Focusing on what brings them joy,
Hmm.
that may bring them, that may bring it down just a little bit. And I'm not saying bring it down in a way that's condescending. I'm saying it in a way that, wow, just what makes you happy? What do you love to do? Let's start there.
Yeah, and for many people, even when they're alone, like maybe it's um, they want to get to church. I have a woman I'm working with, and her whole goal is to be able to get out of the house and get to church. And so after several months working together, like she was able to do that, to get to that place of that, like what brings you joy and how can we get you there? And looking at that, and just even people who want to just get outside and walk, or they, have a little pet, or maybe they enjoyed cooking or baking. It's just what makes you in your soul happy, and how can we optimize your health so that you feel that happiness repeatedly every day.
Yeah, they have to be
Wow.
connected to something to keep going. I mean, they just do.
Mhm.
Like, for the health sake doesn't really mean much unless there's something, like whether it's a purpose, it's a joy, it's a goal they haven't achieved yet. Like there has to be something that you kind of have to grab onto, or else, that's when you see people give up, is when they don't really have that.
It's interesting because whatever that joy is, it's different for everyone. And it could be simple. I know from my grandmother, she lived to 94, and for the last 10 years, I mean, she just wanted to be in front of her television, watching her Perry Mason and her game shows and play with her dog. That's she didn't have any powerful purpose or real why, that was game changing world, impact. Like she just was so joyful in being able to sit on her couch, vacuum to get exercise, and watch her TV and play with her dog. Like that was, she wanted to be left alone. She was healthy till she came down with a cold and pneumonia with her caregiver. Like 94 years old. Is that amazing? So I love the concept of just asking yourself, what brings you joy and how can we get there?
Yeah, I think that's very important to be asking ourselves.
Fantastic. Well, thank you so much. Am I missing anything? I mean, I think this is wonderful. I would love to have Coach Beckie back and maybe even bring in, some patients just to have them be able to um, you know, have some examples of some of these conversations and help some of the patients spontaneously find something that brings them joy. There might be a few of them that you might be able to get some sort of grander purpose that we can figure out. But I think that that would be really inspiring to see that unfold.
Would be. Yeah.
Coach Beckie, are you in?
I'm in. That'd be so fun.
Fantastic. Well, thank you everyone for joining us. If anyone wants to check you out and find out about your coaching, do you have a website? Are you available in multiple states or just Ohio? What does that look like?
Yeah, I'm available in any state. Obviously, you can contact any of the ways of contacting Deidre. You can also connect with me because I do work with her at Aspire. So, any ways that you have to connect with her, she would be happy to be able to connect us.
Ooh, I got a website for that. That's Aspire, WIH
There you go.
dot make sure you check it out. You can also partake in NP Deidre's, of course, it's a cash-based business. They're available um, a lot more often. They can provide you some additional, testing and services in the functional medicine and more holistic front, give you that extension to your traditional care. You want to prevent something, you want to manage something, definitely a good opportunity to get some additional time and resources. But thank you so much to both of you for
One thing
joining us.
I wanted to add too is coaching
Sure.
services are available if you have an HSA or an FSA as well. So that's another thing for people that they don't realize that there are those that they can use those dollars towards a coach as well.
Oh, that's really good to know. So definitely check with your insurance carrier to see what options are available and see how to get those resources, those financial resources transferred over to some of these coaching services because we're all human. It's always nice to have a little bit of support and accountability along the way. But like this video, subscribe to our channels, both our channels. I think it's really, really important. It helps us get the word out there, spread awareness that the support and the resources are available to help you improve your quality of life. So thank you everyone for joining us.
Bye.